Well, let's move back to COVID-19. Of course, last night the President announced that we would move to advanced level 3, which is seeing a lot more industries reopening. At the same time, we're hearing this evening the Western Cape saying they are just days away from the peak of the virus, and also a call for restrictions on alcohol, not only the impact it's having on beds that should be set aside for COVID-19 patients, but of course the horrors of violence against women, a lot of which is sparked by alcohol abuse. I'm joined now by the chairperson of the COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim. Prof, always great to chat to you. Thank you once again for your time. I'd like to speak first to you about what Dr. Keith Clutter, Head of Health in the Western Cape, said to our reporter a little earlier, that they believe they are just days away from the peak of the virus in the Western Cape. Do you agree, and how do you assess when you're near a peak?
Yes, good evening, Salim. Good evening to the viewers. So Western Cape, we know, started rising in terms of its infections somewhere at the latter part of the level 5 restrictions. And so it has been growing quite rapidly since then. And the rate at which it's going now, it's likely to continue rising for at least another week or two, if not more. And so we should expect the peak somewhere in the next 10, 14 days, perhaps a little bit more. It's a bit hard to figure out exactly when it's going to occur, because there are so many factors that impact on it, not least the extent to which people adopt prevention behaviors like social distancing and hand washing.
Yeah, so it really does boil down to those basics in many cases. The other issue that I want to raise with you, last time we chatted, we spoke about alcohol and how it's filling up beds. But of course, we also know that alcohol contributes towards violence in the home. And there is a call this evening on the President from the Medical Research Council, UCT Public Health, plus a number of liquor representatives in the Western Cape. Now, they are calling for 5 very specific things. I'm going to tell you what they are, and just to get your response on whether you agree with this approach. They want to see a ban on advertising, alcohol advertising. They want a big price hike to make it less affordable. They want limited availability, which could be that you're able to buy less or shorter hours for buying alcohol, much reduced drink driving limits, and more counselling. Do you support this call on the President this evening?
I think when we're looking at the Western Cape in particular, because they've got such a dire need for beds, the situation there is acute. And so every bed being occupied by somebody with an alcohol-related problem presents a real challenge to them. So in the Western Cape, there's a strong case to be made for restricting alcohol. The challenge is, if you do restrict it, whether it's really going to achieve its goal, because then it'll be available everywhere else. And I think that that's going to be the issue. I am generally supportive of efforts when areas are going into a rapid rise in cases to free up as many beds as possible, because we're talking really about a period of just a few weeks. And during that period, it makes sense to restrict alcohol.
Prof, I'd like to speak to you as well about yesterday the President announced what we're calling advanced level 3, much more sectors opening up. Something very interesting in the President's Q&A this afternoon, it was raised by the EFF's Julius Malema. He asked a really interesting question. Why are we doing the opposite of WHO recommendations, which is to only ease our lockdown when infections drop? How would you have answered that question?
Oh, I didn't see what the answer was, but it's essentially the following. The WHO designed and created their criteria based on the way the epidemic curves have worked in much of the developed world, especially in Europe and North America. They didn't really take into account the situation that we have, which is quite unique, not quite unique, but we are among a few countries that intervened very early. And we aren't able to sustain our restrictions for that long a period. And because we've effectively flattened the curve, we are only at week 13, week 14, seeing a rise in cases. So the WHO guidelines don't really apply to us in the way they would apply to those who acted late, like the UK, like the US. There's also an issue that we're not the only ones in this situation. Russia, India, Pakistan, all of these countries are busy lifting restrictions and easing their lockdowns and going into a much more economically active environment, while cases are rising in all those countries. So we are in a group of countries that are in this unusual situation.
And Prof, we spoke to you yesterday about the very exciting news that the use of the corticosteroid dexamethasone could actually help people who are on ventilators. But also I was seeing the WHO is talking about a 3-drug treatment combo. They're finding that these 3 drugs can successfully treat mild to moderate cases, and that is the use of interferon, an HIV drug called lopinavir, and ribavirin, which is an oral hepatitis C drug. Is this also potentially really exciting news, or is it too early to say?
Yeah, I think that's just far too early. The data that we've seen from the recovery trial from the UK, led by Oxford University investigators, provides very clear indications for when the drug dexamethasone is of benefit. Dexamethasone does not help, and in the trial that was undertaken, in patients who are still in the acute phase of their infection. In other words, while they are still viremic, the drug does not help. It helps those who are past that stage, who have had the very severe cytokine storm, the immune response that comes against the virus, that leads to these patients requiring ventilators, requiring oxygen. So it helps patients in the late stages of the disease when they have severe conditions. So dexamethasone has a very specific place, and its effect and what we've seen from the trial are quite striking. I mean, that's, to see a 30% reduction in mortality is pretty good. When we look at these other combinations, these are drugs that are intended to work in the early stages. In other words, they are trying to control the replication of the virus. Dexamethasone doesn't impact on the virus. It impacts on your own immune response. So we do need a drug or a combination of drugs to impact on the virus. But as of yet, the data are too early to tell.
Okay. Now, you can probably tell that I've been reading the WHO website, but I found this very interesting thing. It seems trivial, but I actually think it's quite an important one to get clarity on, and it's the wearing of masks. The WHO is saying you shouldn't actually wear a mask when you are exercising. And, of course, I see a lot of people out exercising wearing masks, and I feel guilty if I'm not wearing a mask, so I also wear a mask when I'm exercising. They say that it can reduce the ability to breathe comfortably, and the sweat can promote the growth of microorganisms. So what is your recommendation for South Africans? Should we follow WHO guidelines and not wear masks when we exercise and just be super vigilant about social distance?
Yeah, so we haven't yet looked at the evidence on this particular issue, but the way in which the recommendation has gone is that when you are in the external environment, you should wear a mask. When it comes to exercising, if you are exercising on your own, the need for a mask is less than if you are exercising in a small group. And so that's why it's not recommended that you exercise in groups, that you exercise on your own. And if so, a mask becomes less critical. The extent to which a mask may not be beneficial or may actually be problematic, we would need to look at the data before we can advise differently from our current advice.
All right. Well, thank you very much for that information. That was Professor Salim Abdool Karim, chairperson of the COVID-19 Ministerial Advisory Committee.